Good evening, everyone, and welcome to tonight's webinar on updating your outlook on progressive MS. My name is Ann Gilbert, and I'm the Programs Manager for CanDo Multiple Sclerosis, and I'm happy to be your moderator this evening. For those of you who are new to CanDo Multiple Sclerosis, we are a provider of lifestyle empowerment programs for people who live with MS and for their support partners. Through our programs, we help to empower people to manage their disease and their symptoms and to move beyond their MS by adopting healthy and active lifestyle behaviors. You can learn about all of our programs by visiting our website at www.mscando.org/programs, and you can learn about all of our in-person programs, our 4-day flagship CanDo program that's done once a year, our 1-day Jumpstart program that's done 4 times a year around the country, and our 2.5-day Take Charge program that's done twice a year in different parts of the country. And then of course we have our webinar series where you can access all of our archived webinars and register for upcoming webinars. So remember to check out our website and learn how to register for these programs. You can also connect with us on social media. We have a Facebook page. Find us, like us, and learn about all kinds of up-to-date information about our programs and events. We also have a Twitter account, so connect with us and receive all of our up-to-date tweets. And you'll also find us on YouTube, and here you can browse through all of our fun videos as well as older webinar recordings and webinar archives. So there's just a few housekeeping issues I'd like to go over before we get started. We will be saving the last 10 to 15 minutes of the webinar at the end of the webinar for questions and answers. If you do have a question, you'll notice on your webinar screen that on the bottom left-hand corner there is a chat feature. So feel free to go ahead and type in your feedback, any comments that you might have, or any questions, and myself as well as our speakers will be able to see those questions, and we'll be able to save them for the end of the webinar to address to our speakers to have them answer. So this presentation, it is being recorded and it will be archived on our website, and so because it is being recorded, all of your telephone lines have been muted. So now it is my pleasure to introduce to you our esteemed presenters for the evening. On the screen here you'll see Roz Kalb. Roz Kalb is the Vice President of Clinical Care at the National MS Society, where she develops and provides educational materials, clinical tools, and consultation services for healthcare professionals. As a clinical psychologist in private practice, Roz provided individual, group, and family therapy for people living with MS for more than 25 years. She is the author of the National MS Society's Knowledge is Power series for individuals newly diagnosed with MS, senior author of Multiple Sclerosis for Dummies, and co-author with her husband, Nicholas LaRocca, of Multiple Sclerosis, Understanding the Cognitive Challenges. Roz is also the editor of 2 books, Multiple Sclerosis, The Questions You Have, The Answers You Need, now in its 5th edition, and Multiple Sclerosis, A Guide for Families in its 3rd edition, as well as a proud contributor to our own book, The CanDo Multiple Sclerosis Guide to Lifestyle Empowerment, published by Demos Health. On your screen here, you'll see Patricia Kennedy. Pat Kennedy has been working in the field of multiple sclerosis since 1987. Initially, she worked as a nurse practitioner in a large comprehensive MS center and now works for CanDo MS in Avon, Colorado as our nurse educator for staff and community and program advisor for the organization. She sits on the Client Education Committee of the National MS Society. Pat is president of the board of the International Organization of MS Nurses and is certified as a multiple sclerosis nurse. She serves on the editorial board for the International Journal of MS Care. She has had the opportunity to speak about MS to people living with MS, as well as professional audiences internationally, and contributes to many publications and books. She's the editor of a new book written by a multidisciplinary team of professionals who works as staff for CanDo MS, and that book is The CanDo MS Guide to Lifestyle Empowerment, published by Demos Medical Publishing. So I'm very excited to welcome both Roz and Pat to our webinar this evening.
So thank you very much, Ann. This is Roz Kalb. You'll get to hear our voices and maybe associate our voices with our names, but I'm going to start off by asking you to answer a question for us. We put a polling question up on the screen. Okay. And the question is, do you have a good understanding of what it means to have progressive MS? Mark yes or no. See how you feel about this. Everybody responded? Check our results.
So I think the results should be showing, but it looks like we have 106 responses saying that yes, they do have a good understanding of what it means to have progressive MS, and 68 people said no. So we have 61% who do have a good understanding and about 40% who do not.
Okay, well, that's good to know because I think progressive MS is a challenging concept to understand because it's so different in different people. But I'm going to ask Pat what you think are the most important things for people to understand about what progressive MS means.
I'm happy to do that, and good evening, everyone. I think there's a lot of confusion out there about what is progressive MS, and I think just the name progressive MS, strikes fear in the hearts of people who have heard that word. The term progressive MS really applies to different aspects of MS. It's not like it's a different disease. It's that MS can appear one way or another way, and in some cases we call it progressive, and in others we call it other things. So I would tell you that about 85% of people diagnosed with MS are diagnosed with what we call relapsing remitting MS, and that's when they begin with symptoms and then they subside, or they get better, if not totally better, and then they go on and they may have more symptoms later on. And so this is a period of time, and it can range from months to years, where these ups and downs in symptomatic changes occur. But over time, the number of these relapses diminish. And what happens then is, as a relapse occurs, there are more symptoms that may be left behind that don't totally go away, and there are fewer relapses that come in the future. So that's a progression of symptoms and changes in function that occur over time. And so when this happens, there's a point in time, and then nobody can tell you when that's going to be, but there's a point in time when it's pretty clear that the relapses have diminished and the more constant symptoms have increased. And so this is now called secondary progressive MS. Now, it's still a relapsing form of MS, but there is that progressive component because there are symptoms that are increasing without having the relapses present to make them increase. So 15% or so of people diagnosed with MS have a primary progressive MS. And this means that instead of presenting with relapses and remissions or times when the symptoms are less or gone, people with primary progressive MS seem to present with symptoms of MS, seem characteristic for MS, and over time they remain, and there aren't relapses that go with them, but in fact the numbers of symptoms may slowly increase over time. So this is what we call a gradual worsening over time, and this is pretty much of a hallmark of progressive MS. So we have relapsing remitting MS, and then that may transition to secondary progressive MS, one form of progressive MS. And then we have progressive MS, which is diagnosed fairly soon to the time of diagnosis. In either case, that word is terrifying, isn't it? People don't like to think of that word progressive, and so it isn't something that is diagnosed by an MRI alone. It's usually diagnosed by watching a person over time and how their symptoms come out, remain stable, whatever may happen with them. So it's not something you can look at an MRI and say, this is a progressive form of MS or this is a relapsing remitting form of MS. It's a matter of watching someone over time. So your part in all this is when you go in to see your neurologist or your MS care provider, you want to make sure you are giving them a complete history of what's going on with you. No, I don't think I've had a dramatic change in symptoms. What I think's happened is it's gotten slowly worse over time. But, of course, you have to, when you're kind of in that mode of changing over time, you have to begin making some planning changes for the future because things are definitely not the same as they were. And so part of planning for the future involves understanding the feelings that accompany this diagnosis. And I'm going to ask Roz if she can't talk a little bit more about that.
Thanks, Pat. So Pat's already talked about just how the word progressive conjures up a lot of feelings for people. It is scary, and I think when you combine that with the word unpredictable, which is sort of the hallmark of MS, no matter what disease course you have, it's a very difficult thing to wrap your head around, that the disease is progressive in an unpredictable way. And I think that causes people to have a lot of feelings, certainly anxiety about what the future is going to bring, what it's going to look like. And unfortunately, we still can't answer that question very well for people. We can't explain what you can expect next or when you can expect it, and that truly is one of the most difficult aspects of life with MS. In addition, I think there's a lot of fear and frustration as symptoms worsen and people recognize that their abilities are being altered. Their ability to carry out some important roles in their lives or activities that they value. And with this progression, it can be a gradual change in all of that. And I think in addition to the fear that can cause, there's a lot of grief and anger over the losses of function, the loss of feeling of control. You may have to change some of the key roles that you've had at home or at work, and valued activities. And I think for me as a psychologist, recognizing that grief and the importance of healthy grieving over losses so that then you can move on to making decisions and adaptations about new things that you want to do or things that you want to do differently based on whatever your abilities or limitations may be. I think that there is a certain amount of depression that is common among people with progressive MS. Now, let me say that depression is common in all people with MS. We know that more than 50% of people living with MS are going to experience some significant depression along the way. It's more common in MS than it is in the general population, certainly, but it's also more common than in other chronic illnesses. And the reason for that is that those mood changes are related to the disease process itself. It's not just about your reactions to having a challenging illness, but a symptom of the disease itself. And new losses that are experienced as the disease progresses can heighten some of that depression that's already there. So there are a lot of complex feelings that people have, but I think one of the things that we want to convey to you tonight is that the horizon is definitely looking brighter around progressive MS, and we're hoping that you'll leave this teleconference tonight with a real sense of what's on the horizon and what we're looking toward to help address this challenging phase of MS.
So Roz, while we're going to be kind of addressing this and looking forward, what are some strategies that you might recommend to maintain emotional wellness while dealing with progressive MS?
It's a great question, Pat, because I think some of these feelings are going to ebb and flow with the disease, and so learning how to pay attention to your emotional wellness and manage those feelings as they come up is really important. And I want to emphasize here that I'm talking not only to those of you who are living with MS, but your support partners as well, because emotional wellness is essential for both of you. And so there's nothing that I'm going to say here that doesn't relate to each of you equally. Starting to pay attention to your emotional health is the very critical first step. Sometimes we get so focused on physical well-being and the symptoms of MS that we forget to pay attention to emotional wellness. So it starts by communication, surprisingly enough, that you're paying attention to your own feelings and then you're talking about them with your healthcare provider. Certainly if you notice changes in your emotional responses or your significant changes in your mood, it's important to convey that to your healthcare provider so that the healthcare provider can help you determine what's going on, assess your mood, determine what interventions would be helpful for you. This, again, is a symptom of MS, so this is not about being weak or a wimp or inadequate. This is about paying attention to an important symptom of MS that can occur just like any other symptom that you might have. So you need to talk with your healthcare provider. You need to talk with one another, making sure that in your family, if you're a couple, that you're talking about your feelings and getting them out in the open so that you can begin to deal with them together. You certainly want to also talk with others living with MS because sharing experiences, learning from one another is an important way of coping. So that sharing, coping, and problem solving is important. You learn coping strategies and you learn problem-solving strategies by talking to one another. And one of the great things about that is that when you work on things together, the teamwork makes the challenges seem less overwhelming. You're not doing it alone. And you're also working with CanDo MS, the National MS Society, other patient advocacy organizations. You don't have to do any of this alone, and that really helps to support your emotional wellness. It's also, I think, important to consider connecting with a mental health professional if you experience significant changes in your mood or you're concerned about your mood. We know that depression and anxiety and MS are very underdiagnosed. We are not recognizing this enough. We're not addressing it enough. So too many people are living with untreated depression, which makes the challenges of MS even more difficult to manage than they need to be. So getting that appropriate treatment is essential. It also means that when you're talking with a mental health professional, a counselor, a psychotherapist, you can learn how to build and enhance your own coping skills, your own problem-solving strategies, because we know that people who approach MS from a problem-solving perspective do better with managing their own health and wellness than others do. You can also identify key resources that you can use to help you manage your MS and your life with this illness. I think mental health professionals can also be very valuable in helping you start some difficult conversations. So whether it's with your spouse, with family members, with employers, if you need to have some challenging conversations around any of these topics, somebody who's skilled in this area can really help you jumpstart those conversations. And you can also learn some wellness strategies that you can use yourself on your own time to manage your emotional health and increase your emotional wellness. So you can learn stress management strategies that can help you deal with the inevitable everyday stresses of our daily lives and life with a chronic illness. You can learn mindfulness techniques which can help you deal with your stress, feel more in control, and we now have good research data to show that mindfulness can help treat depression and other mood changes. And you can even learn about how exercise has been shown to improve your mood, and it was actually a finding that back in 1996 with a group of people from what was then the Yoga program, but is now CanDo MS, did the first research showing that exercise geared to a person's abilities and limitations. So personalized exercise can enhance mood along with all of the other benefits that exercise can give you. So the key message is here that you need to stay attuned to your own and your partner's emotional wellness so that you can give it the attention that it deserves.
Thanks, Roz. And you had mentioned prior to this that there is research going on in the field of looking at progressive MS. Can you give us a few highlights in that area?
And I'm sorry,
sure.
this is Ann. Sorry, I'm just going to interrupt real quickly. We're getting several chats that, Roz, you're coming in a little bit soft. Could you possibly speak a little bit louder, and hopefully that'll help our audio with our listeners?
Oh, sure. Sorry about
Great,
that,
thank you.
everybody.
No worries.
I'm talking
Thank
right
you.
into my phone, so let me know if it's still too soft.
I think that sounds much better.
Okay, so let me just say that, I've been working in the field of MS since 1980 when we didn't have a lot of treatments for MS at all. And so for me to be here in this field when so many exciting things are happening, certainly for relapsing MS and now for research efforts in the area of progressive MS, I'm just excited to be talking to you about this tonight. So one thing I want to mention is the International Progressive MS Alliance. And this is an amazing global initiative to end progressive MS. And there are two things that are exciting about it. We have organizations from the United States, which is the National MS Society, from Italy, the UK, Spain, Italy, Australia, among other countries who are bunching their muscles, putting their money together to fund the best possible research to end progressive MS. What this means is that rather than competing, researchers are working collaboratively in an efficient way to find innovations as quickly as possible to discover what it is that makes MS become progressive and to identify treatments that can be effective in its use. So we have to keep our eyes on this. It is a wonderful, exciting group effort that is going to make a difference for everybody with progressive MS. There's also very exciting work going on in the area of nervous system repair. How do we repair the damage that MS has caused? I know several of you asked questions about this when you were signing up for the program. So the work in this area is on how to stimulate the natural repair of myelin that the body does but does more slowly than we want it to. How do we make that happen faster, more efficiently? How do we find strategies that actually repair damage that's already happened? And how do we protect nervous system from being damaged? So work is going on in all of these areas, and I just want to give you one very exciting example of a young researcher named Dr. Jonah Chan. Dr. Chan was very interested in figuring out how we could quickly identify substances that might stimulate myelin repair. He wanted to speed up this process. So he developed a whole new technology which involves the development of micropillars. And what he does is he can very quickly, using these micropillars, demonstrate which existing, already approved substances can stimulate myelin repair. And he was able very quickly to test thousands of them. Now, he only started this a little over a year and a half ago when he won a prize from the National MS Society for innovative research. Since that time, he has identified a substance called clemastine. That is an existing antihistamine. It has already been shown to be safe and effective in people with MS. I mean, safe and effective in humans, pardon me. So it is an antihistamine just like other antihistamines that you might use. And he has found that clemastine has the potential to help with myelin repair. So that is already, in this very short period of time, already in a phase 2 trial for testing the efficacy and safety of clemastine in myelin repair. So we should be hearing some results from that in the not-too-distant future. In another area of exciting research in progressive MS, we're looking at all the different ways that rehabilitation, working with physical therapists, occupational therapists, cognitive therapists, how those interventions can help people with progressive MS. So we're looking at exercise as a way to enhance physical and psychological function, as well as how exercise can enhance mood and how it can improve cognition. So these are equally important and exciting research efforts going on right now, more than ever before, to help people manage the symptoms of multiple sclerosis that's progressive and also perhaps affect the actual disease process itself. So stay tuned and keep checking on in the news, on the National MS Society website, CanDo website, for updates in these areas. But I know you're all impatient, and so in the meantime, while we still have to wait for research results, Pat, folks really want to know how to manage their MS today. So we know that at CanDo we're all believers in a team approach. Can you describe what that means for folks?
I'd be happy to. And team approach, while it makes sense to us because that's what we do, it doesn't make sense to everybody else in the country. A team approach means that when you are caring for your disease of MS, it takes, that old saying about it takes more than a village. And this is what we're talking about when we think about all the different ways that you can address the issues that you face with MS and with progressive MS, and then seek out the help that you need from the professionals that will be of most benefit for you. Now, I've been at this business a long time, and I can tell you that across the country, not everyone has access to every single one of these professionals. But I'm going to kind of go through this list of people who would be beneficial for you so that in your community or your area, you might have some idea of who you might contact or who you might speak with your physician about. Where can I talk to somebody like this so that I can get this extra help? So if we look at the list in front of you, we're looking at people, many of which you already know. You know about neurologists. You know about nurse practitioners and physician assistants. These are people who can work with you and walk the path with you as far as taking care of the disease of MS and helping you with the medications that you take for managing the disease, helping you to look at, is it progressing, is it stable, helping you to look at your MRIs. And I suspect that most of you on this call already are involved with one of these professionals. You mustn't forget people like your office staff at your neurologist's office. And I say that because in many offices they don't have everybody on the team, but they do have someone in the office. So when you call, you're going to be talking to this individual in the office, and you need to be able to explain to them what it is you're asking, what you need, what has happened or hasn't happened. You need to be able to communicate with them and have a good relationship with them, because they are the ones who are then going to say, oh, you need to talk to this person or you need to talk to that person. They are just a very important part of that team that you're going to develop. For many of you, probably most of you at some time or another, the help of a physical therapist or an occupational therapist will be of great benefit to you. Physical therapists, of course, work with things like exercise and movement and balance and working with adaptive equipment and helping you to remain safer and more mobile and learn how to exercise better, all those kinds of things. The occupational therapist can do that as well, and they can also work with you on how do you manage your everyday life? How do you manage the kitchen? How do you manage getting dressed? How do you manage going to work? How do you manage driving? So PTs and OTs are exceedingly helpful, and they're more plentiful than some of our other healthcare providers. So they're people for you to ask about when you talk to your neurologist or your provider. A speech therapist or a speech language pathologist is someone who looks at several things. They can look at how you swallow, because this can be affected by MS. They can look at how you speak and how your words come out, and are they coming out right, or are you forgetting words, or do you kind of get lost in things? And so a speech therapist is very beneficial in this and can do all kinds of testing to kind of direct the kind of therapy that is going to benefit you most. Certainly someone knowledgeable in the field of nutrition is going to be someone that you may want to talk with. Most people ask about what kind of diet should I be on, should I eat this, shouldn't I eat that, is this diet better than that diet? And your best advisor is going to be a dietitian or a nutrition specialist, and you can certainly ask either the National MS Society on their helpline, or you can certainly ask your neurologist as to who in your community is going to be best for helping you with those questions. Mental health, Roz has talked about this. Your mental health is just as important as your ability to walk safely or to brush your teeth. So we need to make sure that if you are in need of a mental health professional for yourself, for your support partner, you know who in your community you can contact, who is somebody that has some experience in MS and they understand the disease a bit. And you can ask those questions when you call to try to make an appointment. Just say, do you have any experience dealing with people with MS? Because that just puts you one step ahead and you won't be having to kind of educate them along the way. A neuropsychologist is sometimes used. Neuropsychologists are psychologists, but they are able to do some of the in-depth testing that we do to look at a person's cognitive abilities. And if you've noticed that you're having difficulty with memory, or you're having difficulty with processing, or with keeping things straight in your mind, you may need to have some testing and then some therapy that will help to kind of zero in on that issue. And a neuropsychologist is someone who is specially trained in this area, and they can do testing that will both find where the problems are and also delineate, is this in fact a problem dealing because of MS, or maybe this is a factor that is due to something else. Remember, everything that happens to you is not MS. You may need to talk with a urologist for issues that have to do with your bladder, where there are many things we can try in the field of bladder management, but ultimately many people end up seeing a urologist so that those symptoms that you're experiencing can be managed, and you're able then to get out in the world and not have to worry about your bladder in so many ways. And let us not forget your primary care physician, because you're still going to get sore throats, you're still going to have tummy pain, and you're going to have all those things. So you need to have a primary care physician in addition to a neurologist. And I know many patients have said, I'll say, who is your primary care doctor? And they'll say, well, you are. And the point is that I'm not. And so you need to have that person who's going to take care of all those other things that you experience over time.
So the teamwork sounds wonderful, and I am a big believer in working as part of a team. But I'm sure people are wondering how they can find a team or create their own if they're not going to an MS center. But before you tell us how to do that, we have this polling question for people to let us know who's on their team.
Okay, so if everyone can hit submit or click to skip results, you should be able to see the results of the survey. But it looks like most people, 97%, obviously they have a neurologist on their team. 92% have a primary care physician. 60% have a physical therapist. 33% have a nurse practitioner, and about close to 50% have a urologist. It looks like not many people, about 3% have a speech therapist, and 11% have nutritionists, and about 16% have occupational therapists.
Good. So
Pat, how do people put these teams together?
It's not something you do right away. It's not something you do all at one time. But I think it's something that you're aware of. And I think as time goes on with your MS and whatever symptoms you're experiencing with your MS, you need to constantly assess what your needs are. The one thing about MS that we all know is it never stays the same. So as time goes on, you need to assess what are your needs, and then as those needs change, you need to talk with the healthcare providers you already have. And if they're not meeting those needs, then you can have that conversation with them about who else do I need to see to address this issue. The National MS Society has a program called MS Navigators, and that resource is on your screen, and I would love for you to take advantage of that. They know all the areas that you live in, and they can try to find someone in your area who can address many of these issues. One other responsibility that is yours is to make sure that there is good teamwork between all of these providers. Now, in the good old days, doctors and other professionals used to write nice little letters. Oh, dear Dr. Jones, we saw your patient today. Well, that's not happening as much anymore. And so sometimes you'll need to actually ask, can I have a record of my appointment today to take to my physical therapist or my whoever? You can ask your provider to send a letter to another provider that you're going to be seeing so that you can keep that communication up. Otherwise, Dr. A doesn't know what provider B is doing, and they don't know what provider C is doing. So you need to help with that. That's your team. And there are also out there care management services that are available, and these folks are able to take someone with complex issues and sort of sort them out and help decide where do you need to go, which people do you need to access, which people don't you need to access, and that sort of thing. And you can, again, talk to an MS Society Navigator to get some help with that and see what's available in your area.
In addition to the help that people with MS can get from their team, I'm sure that people want to know what they can do in the meantime to take care of themselves. You know, we get asked all the time, what can I do today to feel my best, to be well and take care of my MS? So do you have any tips for folks, what they can do?
I sure do. It is so crucial, and I think sometimes you probably feel fairly overwhelmed with all that you have to deal with. And you just think, oh, going in to get my blood pressure taken or having my blood drawn to make sure my cholesterol level is healthy, those sometimes just go by the way because you're so busy with everything else. But it's as important to manage your overall health and wellness as it is to take a medication. And I think we're all in tune to, well, if you have strep throat, you take penicillin. Well, the point is that you may have MS, but you also have a whole body that you have to take care of as well, just as we all do. And so it is very, very important that you pay attention to all of this because it will make the rest of it flow more smoothly. And so this is paying attention to a healthy diet. Exercise. Roz talked about exercise and the research that's going on, and exercise is absolutely a part of everyone's life. We had a question that came in earlier that I saw that somebody said they just can't move particularly well, and so they can't exercise. And the point is, even if, obviously, you're not up on a treadmill, the point is that there are exercises that you can do, and a physical therapist especially is going to be quite beneficial in helping you with that. Making sure that you deal with these emotional issues as they come up, because that's as much a part of your physical health as anything else. And not to kind of put it on the back burner and say, oh, but I have to go, see somebody about this. You need to take care of those mental health issues. And getting those regular health checkups throughout life. So if you're a young woman, you still need to go in for your breast exams, and you still need to have pap smears done. And if you're a gentleman, you need to have your prostate checked. You need to have blood pressure checked, as do the women. So everything else that everybody else has to do is important for you as well. So, Roz, health in general, and now what about health in, I didn't switch the slide, sorry about that. Tips for couples is where I'm going here. What tips do you have for couples to help manage with couples health?
This is something I could spend an evening talking to all of you about. I feel pretty strongly about how important it is for people who are living with this disease to understand the impact not just on the person with MS, but on the support partner as well. When any one person has MS, others who love and care about that person are impacted as well, and we see this in couples all the time. So it's important that as you develop strategies to cope with MS and adapt to the changes that it causes in everyday life, that those strategies have to work for both of you. You need to be a team, and you need to be a functioning team in order to deal with all of the challenges that we're talking about. And so one of the things that I always emphasize when I'm working with couples is how important it is to nurture your partnership and keep it balanced. In healthy partnerships, each person is a giver and each person is a receiver. And each person feels like a contributor to the success and the health of the partnership. And when MS interferes with one person's abilities to do things or to carry out the roles and responsibilities that they have in the past, it's very important that some swapping goes on. Because if it starts to feel as though one person is doing more and more and more, and one person is doing less and less and less to keep the team functioning and the household going, the relationship feels out of whack. And the partnership that you worked so hard to make successful doesn't feel satisfying for either person. So it's very important to talk about your partnership and help to keep it balanced in any way you can so that both of you feel like you're contributing to your relationship. That kind of teamwork relies on trust that you have with one another, respect that you have for each other, your ability to convey information to each other in a respectful, clear, and open way. And that's why I mentioned the counselors before, because sometimes when you're stumbling and you're finding it difficult to have the kind of conversations that you need to have about changes in your partnership and the challenges you're facing, that's when talking with a third party can really help that. So I encourage you guys not to hesitate, and you can always call an MS Navigator at the National MS Society. They're all trained social workers. They can help you, or they can also help you connect with any of the resources that we've talked about, whether it's mental health professionals, care managers, the clinicians that Pat's talked about. They can help refer you to any of those services in the community, and that can help you as a couple to manage these challenges. So now I would ask you another polling question, and that is, are you, your care partner, and others on your support team working together to cope and problem solve?
Well, it looks like that about 80% or 75% are working together to cope and problem solve with their care partners, and about 23% are not.
So for those of you who are having some challenges around that partnership, I really do encourage you to reach out and get some help with that, because the challenges of MS will feel a lot easier to manage if you are managing them together.
So in drawing this to a close, we have some parting thoughts for you. You know, everyone's journey with MS is different, and you know that just from talking to others that you talk to with MS. And because of that, there's no pat answer for everything. And the success of your management, however, of your MS is building that support network that we talked about, using all those resources, having yourself a team out there. And everybody's team is going to look different, but have that team. And all those things go together to make your journey better. Roz, do you have anything to add to that?
Yeah, I think that one of the things you will be called upon to do as you're trying to deal with the changes that MS brings is to be creative and flexible. And that's hard for a lot of us, but I think that your success will rest on your ability to think about doing things in a different way, using those tools that Pat talked about, and being willing to try new things or to do the things that you used to do, but do them in a different way. The more you're willing to think creatively that way, the more you'll find that you can continue to be as active and productive as you choose to be. If you find your life space sort of shrinking because you no longer do activity A anymore because you can't do it quite the way you did it before, and then activity B starts to be a challenge and so you don't do that, and pretty soon you find that all of the activities and interests that made life challenging and fulfilling have sort of disappeared off the horizon, that's when it's really time to look at your own strategies and your willingness to try and do things differently. And that's, again, a very important time when your rehabilitation team, your physical therapist, your occupational therapist, and the mental health professional can really help you think about how to approach those challenges in the most creative and flexible way you can.
So I would say to you as just sort of a final thought, think in terms of being your own best cheerleader. Many patients of mine in the past have said they felt so kind of alone out there because they didn't really have anyone who was supporting them. And while that's important, of course, but you have to kind of set that up yourself. And so think in terms of, okay, who can I call upon to make this journey better for me? And staying in the game and not giving up is probably the most important thing you can do with progressive MS. And many people are able to do this, many people are not. But hopefully you'll gather information that supports you in your effort, and you can stay in the game and move forward and find your life working pretty well if you make the changes you need to make. Some days are tougher than others, but if you use your own resources and those of the team that we talked about, the game is going to have more meaning and you're not going to feel so alone. So that's what we'd like to leave you with tonight, is that thought to the future. So we have one more polling question before we sign off here. And then we'll have a resource information. So do you have the information that you need at this point to better manage your MS? Do you think you've learned some things that are going to help you better manage your MS? Yes or no?
Great. So it looks like we have about 89% who say yes, they do have the information and resources that they need to help better manage their MS, and then 12% say no.
Okay, so we want a point sheet. Oh, sorry, Pat.
Go ahead. I'm just trying to click here. Don't give me the clicker.
So I want to point you to some helpful resources. If you haven't seen the CanDo MS Guide to Lifestyle Empowerment, it is a wonderful book that highlights how that multidisciplinary team that we talked about can help you. Again, contact the National MS Society to speak to a MS Navigator for those referrals. And the Society does offer publications specifically around dealing with the challenges of progressive MS, so I encourage you to look at those. And the web pages that I wanted to highlight for you, if you go to www.nationalmssociety.org, you can search and find out more about that International Progressive MS Alliance that I told you about. You can search on Jonah Chan. His last name is C-H-A-N, Jonah Chan, and read about his research. And somebody asked about clemastine, which is the antihistamine product that he is studying. That's not something you can just go out and buy, although it is an antihistamine like things that you do buy in the store, but it's CLEMASTINE, and you can search on that on the website and read about the research project that's going on. You've asked a lot of wonderful questions here, and I know that we're going to open the lines now for other questions as well, and we'll answer what we can.
Great. Thank you so much again, Roz and Pat. And I did receive a few questions just asking if these slides would be available. And yes, once we exit and end the webinar, you'll receive an email that includes an attachment of tonight's slides, and they are printable for you to have and to just refer to on your own. And also the webinar has been recorded, and it will be on our website tomorrow for you to listen to and share with your loved ones or share with people in your support group. So we did receive quite a few questions, and I want to go ahead and just jump right into them. And this question was asked a few times from several different people. And the question is, what percentage of RRMS patients develop secondary progressive MS? And does that statistic exist?
It's a guesstimate, but 50%, perhaps more, may go from relapsing remitting MS to secondary progressive MS. It isn't a day in time that a person can say, oh, today is the day that I became secondary progressive. It's sort of an insidious change in the pattern of the MS. And so that's why it's so difficult to know whether a person is relapsing remitting or whether they're secondary progressive. But the point to remember is that in either case, it's still a relapsing form of MS because relapses still occur in the secondary progressive phase of MS. They're just not as frequent. So when people ask, and there were questions here tonight about whether people with secondary progressive MS should continue with disease-modifying therapy, that, of course, is a decision between you and your provider. But if you are still having relapses, you are still in a relapsing form of MS, and that is what those drugs were developed for. So hopefully that clarifies that issue.
Thanks, Pat. You did help answer a few more of those questions with that answer. And a second question for you, I think this might be good for you, Pat, is someone asked, is the only difference between primary and secondary MS whether or not a person experiences remitting, relapsing symptoms versus the gradual worsening of symptoms?
That is, in fact, the delineating definition. Someone who has relapses and remissions is usually thought to be in a relapsing remitting phase of MS, and someone who has more of an onset of symptoms and then just slow progression over time without major changes, that would be more considered a primary progressive.
And then, Roz, this might be a question for you. Someone had a question after you were kind of giving tips for couples, and they asked, is divorce rampant or present, or more so present in MS patient circles or in couples with MS?
Actually, the divorce rate in MS is pretty similar to the general population, which is not a great statistic. It's about 50% of couples in general, and it's not very different in MS. I think what is different in MS is that sometimes people who would otherwise have separated, just like any couples in the general population separate, some people with MS stay together not because they necessarily want to be together, but because of insurance reasons or financial reasons or guilt or other feelings. So I think we see some situations where people are together not by choice, which can cause a lot of stress and unhappiness. We also see many, many couples where one person has MS who stay together because they want to be, they're happy, they have good partnerships, they work together to manage the changes. That doesn't mean it's not challenging, but I think at CanDo we have seen many couples who have dealt very successfully with the challenges of MS by working on their partnerships in the way that I was trying to talk about, to make sure that they're keeping their communication open, that they're working together to manage the challenges, that they're getting help when they need it. And so the simple question is that it's not higher in MS, but I think there are complexities that couples have to deal with that some other couples might not have to.
Yeah. And another question here about just how to get your healthcare team to communicate with each other, and this could possibly be a whole nother webinar on its own, but maybe if you two could help answer with this. Someone asks, other than sending letters, how can I get doctors to communicate, or how can I get my doctors to communicate with each other?
Well, this is Pat, and I would say, first of all, ask. That's always the most direct way. They're probably not going to pick up the telephone. In today's electronic medical system, if you're all in the same medical system, it's easy enough to communicate through the email or the electronic records. But if they're in different offices in different places, you can take the information to them. They can send some highlights to the next person that you're going to see. You can't put a gun to their head, but if you can at least ask them to do this, because it's very important. Another thing you can do is when you go in for your appointments, I don't care who it's with, if you take a little digital recorder and you can record the appointment, that's something you can take with you. If you go to your appointment with someone, a friend, a spouse, a partner of some kind, if you go to an appointment and then they go with you to the next appointment, they can make sure that if you're forgetting things or getting, so many facts and you can't remember them all, you'll have someone else to kind of jump in. But I think this is where you kind of take the reins and are in charge of managing that part of your team, is making sure that they're communicating with each other. People would come to me and they, at sort of as I'm at the end of the appointment, and they would say, oh, well, I saw my cardiologist last week and I need to have a pacemaker put in. Well, that might have been important for me to know. But I think sometimes we just assume that that information is coming to us, and it doesn't. So, let's get in there and be your cheerleader and see if you can't get that information to all the other providers.
Anne, I know that we're coming to the end, but I want to give some important information because I see that several people have asked questions about stem cells and their potential as a treatment for progressive MS. And I just want to alert all of you to a wonderful new website that is launching, I believe it's this week, but an organization called the International Society for Stem Cell Research has an existing site, and they're about to launch a new site just for individuals in the lay community, people living with various conditions who want to know about the potential of stem cells for them. So if you can write this down, www.isscrc, and they will help you understand the types of stem cells that are being studied. They will help you understand what the research is trying to find out in terms of the potential benefits for people with MS and other conditions, and also the risks. We do not yet know whether stem cell therapies can be safe and effective for people with MS. We still have a lot of research to do, and the simplest reason why we still don't know if they're safe is the whole point of a stem cell is that it can turn into different kinds of cells in your body. That's how it can help to repair myelin or help to repair any other condition, is because the stem cell can be directed to do something that you want it to do in the body. But we still don't know whether we can control stem cells once they're in your body. So they could potentially turn into something you don't want them to turn into. They could turn into a tumor or some other problem organ or cell in the body. So until we know that they can be used safely in people with MS, we don't know if they're a potential treatment. But this website, in very clear language, will give you every bit of information that you want about the potential of different kinds of stem cells for use in MS treatment. www.isscr.org.
And Roz, I want to say that some people are saying that the web page isn't available, and you had said it's going to be up maybe this week or next week. So if you've tried to find it and it isn't up yet, that's why, because it's not online yet.
Yeah, and I actually just chatted everyone to everyone the spelling of the website. So if you need to look at that, it's right there. And also, I also wanted to echo what Roz had said earlier about the spelling of clemastine. I think a few people had asked again after. It is, I can chat it to everybody, but it is CLE, M as in Mary, ASTINE, and that's with Dr. Jonah Chan, which is CHAN. And I will also chat that to everyone. But, this is all very new and interesting stuff. And Roz and Pat, I appreciate you, and we all appreciate you sharing what's coming up in the horizons and what we can look forward to and what to keep our eyes on. So we appreciate all of your knowledge and your info.
This is Roz. I apologize that there were problems with audio, and if there are specific questions that you need answers to that you couldn't hear what I was saying, please send them to CanDo, and they will make sure that I get those questions, and I will answer them for you.
Thank you.
And
yes,
that would
absolutely.
go for me as well. Mm-hmm.
And I am chatting everyone my email address, but you guys should also have those in your email. But yes, please feel free to send us any questions. And we will have this webinar recorded and posted on the website, and hopefully I can try to adjust the audio so that things do sound clearer, but we appreciate everyone's patience that sometimes the electronics and technology aren't as perfect as we would hope. But again, we thank you for your patience. So again, I do want to just mention a few of our other resources. If you do have questions that you want to ask, feel free to email them to me directly, or you can go to our website. We do have a Q&A portal called Ask the CanDo Team. You can submit your question, and they will get forwarded to either Pat or Roz or to one of our programs consultants or healthcare providers that will be fit to answer that question for you. And also we have our CanDo library, which includes all kinds of library articles written by our programs consultants, and they're on all different sorts of topics, and they're all saved on our website. And new this year is we now have audio library articles. All of our library articles have been recorded, and they're now available to listen on our website. They're read by our staff members, and you can download them as MP3s or as a podcast on iTunes. So very cool offering. So please, go to our website and browse around and have fun in there, and you can see how interactive some of our programs are becoming. And before I announce or share our next webinar's topic, I do want to introduce you to I Conquer MS. I Conquer MS is a new way to fight MS, and it empowers people with MS to securely contribute their health data and ideas for research. Your information will provide insights into enabling new and more effective treatments and research to be developed. So if you're interested in participating, it's free. You just visit www.iconquerms.org, register as a member, and you can contribute all of your information and your ideas. So our next month's webinar is going to be on May 12th, same time at 8 o'clock Eastern Time, and it's all about cognition. Our title is Mind Over Brain, Addressing the Language and Cognitive Challenges of MS, and we're going to have a speech therapist and an occupational therapist joining us to present this program. So join us from the convenience of your home at no charge to you. So again, I want to just thank Pat and Roz for joining us this evening, and for all of you to join us. And we appreciate you participating in our programs. And everyone have a great evening.